Hello, my name is Wanda, and I'm here to do a head-to-toe assessment um, on my patient. Um, Her name is Wanda as well. Um, I already washed my hands, and she emptied her bladder, and we did her Snellen's test, her peripheral vision, and it was 20/20. And just to check her orientation, um, can you tell me what year it is?
It's 2020.
Can you tell me who's the president?
Donald Trump.
Okay, and can you repeat 3 words for me? Happy birthday to you.
Happy birthday to you.
Okay, so we checked her orientation. We know that she's oriented. And I just wanted to show you, I'm going to be using, these are some mock instruments that I'm just going to be using: a tuning fork, a tongue depressor, and a piece of cotton ball, just as part of my cranial nerve assessments. So first off, do you have any concerns?
No, I do not.
Have you ever had a head-to-toe assessment done?
No.
Okay, so just let me explain to you. It's going to take a little bit more time than usual. We're going to check just about every part of your body, your head, your nose, your arms, your rotation. We're going to check your breathing, your heart, and all that, everything that's included there. Right now, I'm just going to inspect your body and your temperature of your skin. Can I just see your skin? Okay. She does have some tattoos. Her skin is nice and warm and is moist. I'm going to do a tinting on her skin, and I'm going to proceed to do capillary refill, which refills within 2 to 3 seconds. I'm also going to take a look at her head. Her head and her eyebrows, her eyes, her eyelashes, her nose, and her mouth seem to be all equal and within normal limits. Her head seems to be symmetrical and about the right size for her body. Her chest area seems to be within normal limits as well. The ears also seems to be symmetrical. Now I'm just going to take a look in her head. So I'm just going to inspect your head, and I'm just inspecting her head for any baldness, thinning of the hair, any debris in her hair, any infestations, and I'm also palpating her head to feel around for any abnormalities of her head, and I don't feel anything. Okay. Now I'm going to just palpate around her orbitals. I'm going to check her orbitals, and then I'm going to palpate her sinus. This is her frontal and her maxillary. You feel any tenderness there? No.
No.
Okay. Now I'm going to check for her femoral, her temporal arteries here. And I'm going to move down to her temporal muscles, and I'm going to be checking cranial nerve number 5, and that's her temporal mandibular joint. And I'm going to ask her to open her mouth and close her mouth. And I can feel, as she opens her mouth, I can feel that joint going up and down. I don't hear any clicking. So that cranial nerve is intact. Now I'm going to ask her to, I'm going to check her cranial nerve number 7. I'm going to ask her to smile, frown, and put your cheeks out. Okay. And then now I'm going to check your cranial nerve number 2, 3, and 6, your ocular, trochlear, and your abducis. Oculomotor, trochlear, and abducis cranial nerves. So I'm going to proceed with also doing a direct and consensual diagnostic exam, checking her, not only her peripheral, her motor, and her ocular movement of her eye. So I'm going to take the light, ask her to stare off at an object, and I'm going to look to see if this eye dilates and constrict, and it does. And I'm going to have her do the same way with this eye. It dilates and constrict. Also going to go across. Let's see if I can see a red cone in your eye. Okay. So her eyes are equal and reactive. So now I'm going to do, I want to ask her to follow this pen light so that I could do her motor functions of her eye. And we're going to go, just going to follow the pen light. You don't move your head, you just take your eyes and follow it. Up. Very good. So we know that cranial nerve is intact. I'm also going to do an accommodation. I'm going to take this pen light and go to her nose, and both her eyes shall come together and accommodate. Accommodation is intact. Now I like to do a motor sensory coordination. So I like for you to take your nose and point it at the pen light, but just stare off and see if you can take your finger and point it to the pen light. Touch the pen light. There you go. Don't move your head, just moving your eyes. Very good. So we know that cranial nerves number 3, 4, and 6 are intact. Also, we're going to check her olfactory nerve. I'm going to have her close her eyes, and she is going to tell me what she smells.
Vanilla.
Okay, and she's right. This is vanilla abstract. Also, we're going to check the patency of her nose. She's going to do one nostril on one side, blow out, and the other nostril on the other side, blow out. Thank you. And then while I'm doing her nose, I'm also going to check her nose for symmetry. And I'm going to take a look in her nose, and I'm going to look for any deviated septum or anything, any turbinates, and her nose look pink and clear. Very good. So we know that olfactory 1 is working. I'm also going to look at her sclera on her eyes. So I'm going to feel around and just look at the sclera. Open your eyes, look upward, and her sclera is nice and pearly white and pink at the basis. Okay, then I am now going to do your cranial nerve number 8, which is your vestibular cochlear nerve, which is your hearing. I'm going to ask you, I'm going to inspect her ears for any debris. I'm looking at the pinna. and I'll be looking into the canal of the ear for any debris. I'm checking behind the mastoid process for any abnormality. And I'm going to hold this pinna up, and I'm going to look inside. And this is the right side, so I'm looking at the tympanic membrane. Tympanic membrane is pearly gray and at the number 5 cone. So in any other side, the other ear, I will do the same way. Look inside, pull the pinna up inside, looking at the tympanic membrane, which is pearly gray, looking at the canal, and her cone of light is at 7. Now I'm going to do a hearing test on her. I'm going to ask her to cover one ear, and I will do a whisper test on her. So cover one ear, cover your right ear. And I need you to just tell me the words you're saying.
Happy birthday. Good morning.
Very good. Now, I want to proceed now to check her mouth. I'm going to do her mouth now, and that's going to be cranial nerve number 9, 10, and 12. 9, 10, and 12. Cranial nerve 9, 10, and 12. My hypoglossal and my glosseal, hypoglossal, and vagus nerve. So I'm just going to have her to lick out her tongue. I'm going to look inside. And I want her to say ah.
Ah.
And I can see the uvula in the back. It's midline and it's vibrates. Also going to have her lick out her tongue again and say ah.
Ah.
And I know her gag reflexes works. Also going to have her, you're going to lift your tongue up, and I'm going to look for any debris in that hypoglossal area. Open your mouth again. I want to look in the inside of her mouth for any debris, and I'm also looking at her dental work, which is very good. No missing teeth, very good hygiene in the mouth, and her tongue is nice and bright. Also would like for her to stick out your tongue, wiggle it around, okay, and swallow for me. So we know that her cranial nerve number 10 is working. Now I'm going to proceed down to her tracheal area. I'm going to check her, palpate her trachea with both fingers. And then I'm going to check the thalamus, which is in great condition. I don't feel any lumps or bumps. Tracheal is midline. Swallow again. Very good. Okay, then I'm going back and we're gonna check your lymph nodes. I'm just gonna palpate in the back area and around in her lymph node area. So I'm gonna check your preauricle, your postauricle, your occipital, submandibular, any pain?
I'm okay.
And submental. Then I'm going to look for the cervical chain, supraclavicular, super cervical, deep cervical, posterior cervical, coming down to the superior clavicle and then inferior clavicle. Then I would like to do her testing on one other test on her eye, which is the testing of her retina, and I will use the trabecular scope. So I don't have one of those, but I would normally look into her eye, and I will come straight towards her eye and look at the retina and look for the veins and the arteries in her retina to see if there was any abnormality. Also, with the hearing, I like to do the Weber test and the Renin test. My tuning fork, I'm going to give it a ding, and I'm going to check going to place it at the top of her head and ask her, does she tell me when she stopped hearing it?
Don't hear it anymore.
Okay. Then I'm also going to ding it again, place it behind the mastoid for the bone auscultation, and then I'm also going to do it in front of her ear for air auscultation. So we know that that's intact. Also going to do a sensory for touch, and I just need you to close your eyes. And can you feel that?
Yes.
Does it describe it?
Soft.
Okay. You feel this one?
Yes.
You feel that?
Yes.
Okay. Very good. Okay. Now, for cranial number 11, I'm going to ask her to shrug her shoulders. Very good. All right. Now I'm going to listen to her carotid. I'm going to take the bevel of my stethoscope, and I'm going to listen on each side. Take a deep breath in. Hold it. Same thing, deep breath in and hold it. Okay, you can breathe out. So now I'm going to look at her anterior and posterior sides. So I need to make sure that they're symmetrical. So I'm going to have her turn sideways. Okay. So looking at the anterior and the posterior, they both seem symmetrical. I am now going to listen for breath sounds, and then I will auscultate her vascular and cardiac sounds. Okay, so just need you to lay back. I'm going to check your jugular vein distension at a 45 degree while you're laying back with the bevel of my stethoscope. I'm going to have her turn her head, and I'm just going to look for any vein distension, which I don't see. And on this side as well, any vein distension, which I don't see. Okay, and I'm going to go on this side because I think you can probably see me better. So I'm going to auscultate anterior. She looks great. I'm going to palpate the your thoracic area. Any abnormalities. Okay. And to palpate. Now I'm going to listen to your breath sounds. And I'm going to do both on each side. And I want to make sure that the breath sounds are the same on each side. Lift your arm up laterally. Okay. Lift the other one up laterally. And her breath sounds are clear in all fields. Now I'm going to listen for your arteries in your upper anterior part of your chest and your aorta, which is at the second intercostal space. Your pulmonic, which is at the second intercostal space. Your Erb's point, which is at the third intercostal space. Your tricuspid, which is at the fourth intercostal space. And your mitral valve at the fifth intercostal space. And your S2 is heard the loudest at this point. Now, I use my diaphragm for that. I'm going to go back to those areas. I'm going to use the bevel, and I'm looking for any murmurs or bruits. So we're going back to the aorta at the second intercostal space. Point at pulmonic at the second intercostal space. Point at the third intercostal space. No bruit. Tricuspid at the fourth intercostal space. Mitral valve at the fifth intercostal space. And I also can try to listen at the apical. Okay, very good. Now I'm going to inspect this lower part of your abdomen. It seems to be fine. Just going to inspect it. Now, I'm going to listen at your quadrants, the lower quadrant here. And I will take up to 1 minute, 5 minutes if I had to. Okay? And all 4 quadrants are active. Now I'm going to listen to your vascular in this lower abdominal area. I'm listening for the aortic, vascular, the iliac, renals on each side, renal, iliac, femorals. And while I'm down at the femorals, I also want to feel the lymph nodes in that femoral area. I also want to take and find that umbilical to make sure that the umbilical is midline and is not indurated or protruding. Now I just want to do a light palpation. I'm feeling for at the border of the hepatic organ. I'm feeling for dullness. I'm feeling for tenderness. Okay. And over at the splenic area, I'm doing the same thing, just a light palpation. And then I'm going to do a deep palpation. And I'm just feeling for any type of splenomegaly. Same thing here from the border up. I'm feeling for any type of splenomegaly, hepatomegaly. Now I'm going to percuss the area for any dullness. Okay, very good. Now, I want to check your brachioradialis, and then I will look at the other part of your body. But I want to check your radialysis and your brachial arteries. Brachial arteries are +2. Radial is +2. Same way on this side. Radial +2, brachial +2, radial +2, popliteal arteries +2, dorsal pedius, and tibial pedius, and they're all +2. Now, I want to take a look at her legs. Any edema, any abnormalities. See any edema, no abnormalities on her legs. Want to have her to flex the one leg up. You do your left leg, just flex it at the knee, pull it up. We're going to do a flexion and flexion and extension. Do the other one, flexion, extension. And now I'm going to have her rotate her hips. You're going to rotate the one leg over the other side. Okay. And then we're going to pull it back, abduct it out, and adduct in. Same way with the other hip. We're going to bring this leg over here. You're going to take that leg and abduct it out, and then abduct it in. Okay, I need you to pronate your feet. So can you bring your feet into pronation?
It's a bad camera angle. Chair.
Okay, so bring your feet into pronation and then extend them outward. I would like for you to hyperextend your feet and then bring them back. And now I'm just going to check your resistance on the feet. If you can see me, I'm just going to have her push up against my hand and push up against this leg, and you can't see me. Okay. So I'll go around the other side.
Or you could have just pushed the chair, push the table that way.
I'm going to try to push against my hand and try to push against my hand. Okay, now I'm going to have you sit up, and I am going to listen to you posteriorly, so I need you to turn towards your back towards the camera. And I'm going just palpate her posteriorly. Inspect. Gonna auscultate from the apex. And I want to do it in sequence so all the sounds are the same. Breathe in and out for me. Breathe in and out. Breathe in and out. Breathe in and out. Breathe in and out. In and out. And these are her lower lobes. Breathe in and out. Breathe in and out. So just checking her cervical spine here, all the way down to her lower lobes and around her thoracic area. Okay. I'm going to percuss this area. And I'm checking for any resonance, any dullness, any ascites. Okay, I think we got you. Now, I would like for you to turn around and let's do your reflexes. So I'm going to take the bevel of my
Push it back, or push the table back. Turn this way. So you push the table back just a little bit. So you can see my feet. So you can see my feet.
Yeah, I'll just tell you to move out a little bit. Okay. So I'm going to take the bevel of my stethoscope and I'm going to do her refluxes. So I'm going to do brachial here, radial here, the back of the arm, and we're checking for positive refluxes. Here, back of the elbow, and that elbow. And then radial here. Gonna move down past the patella, and there, and there. And then I'm gonna check her Achilles. I'm gonna sit back a little bit.
Let's push the table back. Let's push it back.
Okay, put your feet up. And I'm checking for the Achilles back here. And on the other side. And the Babinskis. Very good. So now we are I'm going to show a little bit of breast exam, reproductive organs, and explain that, and then we're going to get up and do range of motion. Okay, so lay back. So for me to do her breast exam, I would have her put her arm over her head, under your head. Put your arm under your head. Okay? And I'm just going to start from the clavicular area, and I'm just going to go all around the breast area, just feeling for any lumps or anything that might be abnormal. And I'm going to do that on both sides. And I'm going to make sure that the patient knows that she's supposed to do a breast exam every month. Okay? And you can sit up. Now I'm gonna have you do a little bit of range of motion for me. You wanna get off the table? Okay, so we're gonna check some upper body range of motion. And I'm gonna have her to shrug her shoulders once again and with resistance. There you go, very good. I'm gonna have you just bend over and I'm gonna check from your cervical down. Bend over for me. And I'm checking from this, you too far down. Checking from the cervical area down your back. And we're looking for kyphosis, lordosis, and scoliosis. And that seems to be fine, okay? Bring your head up, turn around this way. So I also need you to extend your arms out, extension. And then turn your arms around, and we're gonna do flexion on the arms, flexion on the arms. And then I'm gonna have you to abduct your arms away from your body. And we're gonna pronate her wrists externally and internally. You're gonna flex the wrist. You're gonna open up your fingers, abduction, and then bring them back in as adduction, okay? And then I'd like for you to flex your head downward, flex your head back up, and then I am going to check for resistance behind her head. You want to turn your head to the right against my hand. Go ahead. Okay, and then this way. Okay, and then turn around. And I'd like for you to put your arms up and see if you can push against my hands. We're just checking for strength. And then squeeze my fingers. Very good. And then now we're going to do a lateral rotation. She's going to have her turn to the left and to the right, laterally. Okay. I kind of think that concludes most portion of this head to toe. Now, I just want to talk about, one other thing. Can you turn back around? And I just want to check for some rebound tenderness on her renal. So, okay, thank you. All right, thank you very much. So I just wanted to let you know about your history. Your head to toe assessment came out very good. I didn't find any abnormalities. You have any questions for me?
No.
Just wanted to go over do you have any anxiety, depression? Do you smoke or drink?
No.
Any social issues?
No.
Anything that concerns you that you would like to talk to me about?
No, not today.
Okay. All right. Thank you very much. And I will proceed to now explain my other part of this examination. You can have a seat. So if I was doing, well, to do a gynae exam, I will have to have the young lady to get up in the stirrups. I will use a speculum, a warm speculum, and I will check her cervical area, and I'm going to be looking for any discharge, any redness, any irritation. I will actually take a sample from the cervix area, put it in a solution to be sent off, and I also will palpate around in that area with a pair of gloves just to check to see if there's an abnormality in that area. If I was doing a male reproductive exam, I would glove up. I'm going to take a look at his testicles to see if they both are the same size. I want to see if there's any abnormality on the testicles, if you have any rashes, anything that's abnormal, I would want to note. Then I will proceed to do a rectal exam to check for his prostate. His prostate should be about a size of a walnut, and I would note that as well. This kind of brings me to the conclusion of this exam. Thank you very much.